Hey everyone, we're live at Wave 2025, and we're here to talk to our panelists about innovation, AI, data, and how you see it shaping our respective industry.
My name is Ian Womack. I currently have the privilege to serve as the Fire Marshal for the city of St. Petersburg. So I work for St. Petersburg Fire Rescue. I've been there since 2002. Before I was the Fire Marshal, I served as the EMS Chief for almost 10 years in that same system, and we're a public utility model, true high-performing EMS system. Pretty proud of that. I started the fire service in 1998 for another organization, the son of a contractor, so the Fire Marshal is a nice fit now. I've had the privilege in the industry to do a lot of different areas. I've worked in every major program area. I've implemented new technologies in not just our own organization, but other organizations. And I've had the privilege of working in the consulting side of public safety for about a decade. So the ability to look under the hood of other organizations, how they collect and use data, has really revealed a lot about data integrity these days and some of the challenges we have with these big macro data sets. But also on an organizational level, what things are actually implementable in reality versus what things do we conceive are implementable in the design space or the leadership space. Seeing how organizations are impacted by being a third party kind of, you're a neutral party going in to look in the consulting side has been very beneficial. So I've been fortunate to have a rather rich career in all things kind of public safety as well. So it's a pleasure and a privilege to be here. This is an extraordinary group.
Bharat Sutariya. I'm an emergency medicine physician originally from Detroit, and trained at Detroit Medical Center and have ridden with EMS dozens of times, and obviously on the receiving end in the emergency department, providing trauma and medical care. Currently, I'm the Senior Vice President and Chief Health Officer at Oracle Health, a technology company that provides technology across the entire continuum of care. And an interesting part of talking about the continuum of care, what excites me is that I think we have an obligation to truly complete that continuum, because right now pre-hospital space is pretty much disconnected from the hospital space, and we have to establish that connection for data sharing and record sharing. So every EMS personnel that shows up at the house, or the fire that shows up at the house, can access the complete medical record and make the right decision on the front end. And then as the patient's arriving back into the emergency department, they already understand who's coming, with an identified information, so that all of the care planning can take place before the EMS gets there. So we have some enormous opportunity on the basic connectivity and foundation end. And obviously with all of the AI that's coming in the future, I'm super excited about the possibility of solving some complex healthcare problems.
I'm Jeremiah Nelson, Corporate Vice President at Motorola Solutions, going on 18 years. I lead a group that we call Response Reporting and Evidence. So that's really the core workflow of public safety, 911 call handling, computer-aided dispatch, law records management, body cameras, vehicle cameras, evidence solutions, situational awareness. And what we're trying to do every day is create software that drives a better outcome for the communities that we all live in. And the technology trends that are upon us are tools that can help us do that. And it's an incredibly exciting time to be working in this space.
And I'm John Basmadjian, Chief Product and Technology Officer here at ESO.
The fire service doesn't create technology. Typically, we're a consumer of it. So maybe I could share the perspective of where I think it'll impact us from a consumer's experience as these things move forward. And I think one of the things that drives concern for us is what is the impact on the quality and behavior of our practitioners moving forward. So AI is a great tool to leverage efficiencies and perhaps increase the speed and accuracy of decision making and all that. But as it does that, does it create complacency in the providers themselves, right? Do we lose the ability to be contemplative and cognitive about the actions and decisions that we're making, and not just in the moment when we're responding to active risk, responding to an accident or a fire or a medical incident, but when we're planning deployment and we're planning risk mitigation strategies that are prospective moving forward. Do we maintain a posture where we question the outputs that are coming from these tools and make sure that they're well calibrated to the realities that we'll face? So I think that's what creates the most concern for me when we see those technologies emerging. The other side of that is the human element side. Technology will progress. It is already, right? Faster than organizations and people can absorb those changes. And in our organization, our industry, we're a mixture of about 5 different generations at this point, right? Some are very comfortable with technology, but a good chunk of our industry still, it creates a lot of uncertainty, which creates a lot of other subsequent emotions as well. So we have to deal with that challenge. And then the third piece is we're government. And you guys have probably noticed we don't move quickly, right? So just the procurement implementation process on government is a drag to the pace of technology and implementation. So another concern is how well can we implement and maintain pace with necessary improvements in these technologies once you adopt them, when we're still encumbered by that kind of bureaucratic government purchasing process. It's a little different animal for us in that space than in the private enterprise piece. So,
at Oracle Health, obviously we focus on providing technology across the entire ecosystem: healthcare, provider, payer, consumers, across the board. But what's common to all that we're trying to do right now is we're trying to restore the joy of medicine, practicing medicine for the practitioner. Over last couple of decades, the burden of documentation, the burden of regulatory compliance, hey, you have to meet this measure, that measure. Mm-hmm. So clinicians feel burnout. So what we're trying to do is restore the joy of practicing medicine and take the burdensome task from end users, whether they are EMS providers or they're ER doctors or nurses or post-acute social workers, so that they don't feel like they're burdened by administrative tasks, documentation tasks, billing and charging tasks, and use AI and agentic AI to solve a lot of that basic problem and then free up the clinician's time to actually practice medicine, number one. Number two, we want to elevate the practice of medicine from a memory-based medicine practice to a practice that's actually guided by decision support. Intuition is still super important, but if I can queue up the information for clinician based on the comprehensive read of the record, then the clinician's ability to make that decision is going to improve both in time and in accuracy.
That's right.
And I think if we do all of that, at the end, what matters the most is, are we improving the outcome for the population that we so much care for, right? And that's how you build a sustainability of health system. And we want to leave it, better behind, right? For our next generation.
If I could just make a comment on that, sustainability. I loved what you said on the front side, right? Get the clinicians back to practicing medicine. And I'll tell you, as in my 10 years in EMS chief, personal experience, then I observe it in agencies we go to. One of the challenges we're really facing in the EMS industry right now is clinician burnout, which is creating shortages in the hiring process. I haven't run into an agency yet that says they have plenty of paramedics, right? But when you engage with our people and ask them what is driving the burnout, it's not the clinical care, right? It's all the documentation piece on the front side, right? Mm-hmm. These people didn't come into the industry to be, documenters or attorneys, right? They came in the industry to get hands-on and provide care. So developing technologies that does that, it absolutely will impact sustainability and lessen clinician burnout. That's very exciting.
I think what you just said is so spot on. When we look at the response part of what we do at Motorola, the biggest challenge that we see fire EMS 911 facing is staffing shortages. And at the same time, you're having a difficult time hiring and putting butts in seats. You've got an increasing burden. Right? Make sure everything is documented perfectly, or the case is going to get thrown out, or you're going to get sued. The amount of work that we've been putting on people, even, literally more things, more devices, more technology, right? It's just been an increasing curve of complexity for everybody to deal with on the front lines. And that's not, to your point, what people signed up for, right? They signed up to help somebody when they needed help. AI can begin to be a thing that takes burden away if it's implemented properly. If it's implemented poorly, it will make it worse. But if it's implemented properly, it's going to be something that gives time back. And that's what's really transformational.
That's right. And to Bharat's point, right, putting the joy back in health, right? How do you do your job as someone in EMS, as a physician, where you have that joy, that love of what you do, and it shows, right? And how you engage with patients, how you drive outcomes. But again, to your point, if you're sitting there filling out docs, right, pre-visit, post-visit, and it's taking up hours and hours, absolutely agree. That's one of the things I'm excited about here at ESO, is looking at how do we kind of take, and if you did the stacked bar chart of all of the activities that different providers do in their space, right, through this continuum of care, what does it look like? I mean, we've all got those activities that we do in our regular day jobs, that there's some bottom of the barrel activities, and there are ones that, as you mentioned, bring us joy. So how do we start to maximize, and maybe it's a carryover from our conversation up here on stage, but how do you maximize the human effort on the things that bring us joy, the highest order of activities that right now AI can't, and for some period in the future will not be able to solve for, interactions, right, and human level connections, but then kind of source the rest of it, right? Source the rest of it away. There's got to be a way to automate, data check, do all these other elements that will pull away, as you mentioned, some of the burden, right, of those activities.
Absolutely. So I think, we have if you kind of imagine the future, not in decades, but just in a short 2, 3 year, 4 year time frame, imagine what we can achieve. A person calls 911, 911 operator already, of course, today already have context of where they're calling from and so on. But now that record is linked to their medical record, and on screen pops up their medical record. So they know exactly, hey, this patient's calling for chest pain. Oh, wow, they just got discharged from the hospital. They can see that on screen, right? So they dispatch an EMS. EMS already on their tablet has that record loaded. So as they're heading to the house, they're already seeing the rich history. So you're not spending all the time updating new history instead of you confirming it, right? Now, as you load up that patient in the truck and you're heading to the ER already has the notification, not only XYZ age patient coming with chest pain, but specific patient with all the histories, because they can see it on their screen and they can get the care protocol already going and all the services notified of the care that is needed, right? I mean, that's just the beginning, and that story then just continues on, right? When we establish the connectivity, when we establish the data exchange, and when we layer the AI on top of it, it can make everybody's life easier.
One of the things I'll jump in on that is you think about all of the data that's becoming available. As you mentioned, healthcare has done a great job now digitizing, putting paperwork into data. All that's available now, and you start to think about the absolute deluge of data that's available. It's overwhelming to a person who's responding in a moment, right? If you've got a couple minutes until you arrive on scene, you don't have time to read through a 1,000 pages, right? And this is a spot where AI can shine. So at Motorola, one of the things that we've done is we have a product called Assist for 911. And Assist for 911 goes and reads everything that we know when a phone number comes in. So what do we know about the home? What do we know about the household? What do we know about the family? They may have shared opt-in information, about their medical history, that kind of thing. And, if you put that all on a screen and expected a 911 dispatcher to read that while they're triaging a call and directing a response, it's overwhelming. But the AI can read it all and say, hey, this needle in the haystack here, you might want to pay attention to this. And using AI to surface that stuff and help people get through that is one of the easy ways to drive a better outcome.
Yeah, and tell me more from Motorola's perspective on how you see AI changing the landscape of dispatching communications.
Yeah, it's really about driving a better outcome and with a focus on time primarily, right? So where can we leverage AI to help do tasks that are mundane, repetitive, or difficult or impossible, like I was just describing on the situational awareness problem. You can't watch every camera, you can't see every data feed, you can't process that. So AI can, right? So you can use an AI for that hard task, that human impossible task, to get a better outcome to occur. But if you think about in the 911 response, right? Again, go back to the staffing shortage problem. A ton of the work that folks are asked to do isn't work that they should be responsible for. The bot dial problem is a huge plague. 911 call centers are in there. You are obligated to call back. You don't know why that call came in and hung up. You don't know it's a butt dial, but so you have to follow it up. Well, every time you're following up one of those is a time you're not available to actually do what you were supposed to be doing, right? So can you have an AI agentic workflow that queues those up for follow-up? And if you need somebody, if you get somebody and they are indeed an emergency, you route that right back to human as quick as you can. The AI doesn't do that job, right? That's the job of the human. But the dial back, the test, I didn't mean to dial response, that doesn't need to be handled by, a 911 dispatcher or 911 call taker. We can free that up, right? So if you do that right, you give time back, you reduce the stress and the mundane part of the job, and you let people focus on what they signed up to do in the first place, which is stay helping people.
So if I could take a privilege and make a request then direct the purveyors of these technologies, a tremendous opportunity on the dispatch piece in the future. So much of it is relying on the sender receiver relationship. So, medical party dispatch, those protocols have been around for decades, right? But that's still reliant on how are you communicating your physical condition to me, and how am I receiving that and interpreting that and plugging it in to drill down to this acuity level and subdeterminant level for what you're calling 911 for, which we have bucketed into. This is an emergency. It's not an emergency. This needs a BLS response. This needs an ALS response. It's a best attempt, and it's been useful for system efficiencies and designs, but a lot is missed in that communication, interpretation, sender receiver relationship. So nearly half the world today, I swear, are wearing devices that are measuring their heart rate, that have the ability to measure your SpO2, or your respiration rate. There's so many things in this connected world that are producing outputs on our physical well-being in the moment that we have failed to connect to the 911 process.
Yep.
So there's maybe even a better opportunity to start connecting some of those systems and services through the very device you're calling 911 on. So if the caller is the patient, then it's immediately developing a profile that doesn't rely on the sender receiver interpretation. It's taking hard data points and determining what level of severity and acuity your request for services.
We couldn't agree more. And one of the big areas of investment in Motorola Solutions is around this community connected concept. So the Motorola Solutions, we like to say we're solving for safer by being able to thread these enterprises, communities, and public safety together in a way that nobody else can. And a big part of that is developing that ecosystem of partners who can share that information in. And that goes back to the kind of the 911 assist problem, right? As well, like now you've got so many devices and so many pieces of information coming in, you get overwhelmed by it, right? So the AI can help with that, but there's an assumption there that you've got it all wired up, and that's happening now. Why can't I turn the video on? And why is a 911 call a 911 call? Why can't I FaceTime 911? Why can't I do a video call in a 911? Why can't I WhatsApp 911? These are things that need to be solved and will lead to better outcomes. Similarly, like you think about on the drone side of the house, as drones as first responders become pervasive, if you can get eyes on a scene in 2 minutes without having even as the truck is just starting to roll, you can get a much better assessment of what's going on and modify the response before somebody even shows up, or call it off altogether and save that resource for who actually needs it.
Yeah, it's remarkable to me that in 2025, our most advanced fire alarm systems are just voice evac, right?
Yeah.
It'll detect smoke and say, fire, get out of the building, fire, get out of the building. And then it just pings something alarm. Oh, we got a smoke detector in room 4. What is that? I don't even know what that means, right? And it's 2025. I guarantee the building that fire alarm system in is wired to the teeth with wireless internet. It's communicating data out about all other kinds of things. I would love to, we get to the point, these systems, why can't a building call 911 and say exactly what's wrong?
You can actually see it.
You know what I mean? Yeah. I'm on fire. My bed is on fire in bedroom 2, but nobody's home with me. It's just me as the building. Like, that's real information that we can immediately dial in a risk-based response. And it also, helps us dial in how much risk we assume when we get on scene as well. Yeah, I mean, the sky's the limit. We could go on and on about all these cool things that the technology should enable us to do very soon.
And then, Bharat, how do you see this changing how hospital and health systems will leverage this new sets of data or new ways of looking at data moving forward?
I think it's everything from efficiency. So in terms of command center, knowing, having the connectivity on all sides, both on the receiving side and the sending side from and to the hospital, it helps the hospital command center plan for operations. As you know, today, many emergency departments run into what's called boarding challenge, where patients who are already fully treated in the emergency department are waiting for inpatient bed, occupying an ER bed, which is critical for the next patient to have, right? So lots of hospitals are going through these challenges. And I think having this connectivity across the board and knowing who's coming, who's going, how fast they can go in and out, all sort of helps you with an operational efficiency. And number one. Number two, I think that the data exchange between the pre-hospital and the hospital side, and using that data to actually avoid unnecessary transfer, benefits everybody, from patient to fire department to EMS to hospital, because now you're not taking resources, precious resources, and wasting on a situation that doesn't benefit from it. In fact, that patient who just called benefits most from going to primary care. So how do we facilitate that versus transporting them to an ER and taking extraordinary expensive resources which somebody else could use? So there's a lot I think we can do, from using that data through the connectivity and then running the AI model on top of it to assist in a much better decision making. So almost avoidance of unnecessary care part of it, right? But then you get to the most important part, which is the true emergent situation where someone has a life-threatening condition and you need to have a complete coordinated care all the way from the 911 call, till they arrive into the hospital. And even after arriving in the hospital, all of the teams that participate in their care need to be notified ahead of time, need to have the context shared with them so they understand what's coming. So you could orchestrate that entire care before even the person gets there, right? So those are some of the opportunities that we're excited about. And I think those are the kinds of things that's going to lead to the improvement in health outcomes.
A better outcome can be achieved by bridging that information all the way back to the PSAP at the start, right? It's just as simple as that. If you know this, if you know a person's medical history, if you know where they should be, what conditions they may have, and if you know the status of the emergency rooms, like I think about this, like where's the wait time longer? It might be faster for me to drive and drop someone here, but the hospital across this, a few blocks away is open and available. If we can begin to bridge that information, and it's all doable. These are just APIs and systems talking to each other. You can really drive better outcomes. And as an industry, that's what we need to be focused on, is how can the technology drive a better outcome?
That really kind of that ties back to something I mentioned at the start, right? Technology will be solving the problem faster than the regulatory environment can keep up with it. So take some of those scenarios you just mentioned. The regulatory environment's not ready for that, right? I still can't get reimbursement if I take you to your primary care. It's the most appropriate destination. So I think we have to work both of those problems in concert, because if the technology spears out and can facilitate it, and we have no way to get reimbursement for it, or we're not even allowed to do it even for free, we can't leverage some of these things. So we really have to be working both sides of that equation, to make sure the environment itself is prepared and accepting of those emerging technologies.
That's true. So I'm seeing there's a technology component. There's the data piece. There's also the regulatory piece. What are your thoughts around, as a consumer, as someone who's receiving healthcare, what are your thoughts around maybe some of the change, or if you think about having this communication with folks in your family, maybe some of the older folks in our families that are starting to require higher levels of care? How do you see having those conversations with them to help them think about, hey, healthcare is going to change, your experience is going to change, and these are some of the things that we see happening? How do you see that happening with the general populace at large, of how we talk about the change that's coming?
I think, one of the conversation I do with my family, right, which ranges in all ages, is one, I tell them, you have to be better steward of your own care, number one. And that means you have to know your condition, your medication, your doctors. And if you can't remember, here's a phone, here's an app, here's a place you can go store. So it's always accessible to you. So take care of the basic thing that actually is a life-saving moment if those information is available. So I teach all my family members to make sure they have their medical information. Two, increasingly what I'm teaching them or advocating is to interact with their provider digitally. The phone calls and waiting 24 hours for the doctor's nurse to call back are gone days. And now you should be able to send a message, and the clinicians are getting better and better at timing, very timely sending their answer back to you. So learn to interact with your entire healthcare ecosystem digitally, whether that's refilling the prescription and you get a text message to say, hey, should we refill your prescription? Pay attention to that, right? Whether that's your doctor's office sending you a reminder that your appointment, is coming up, or you sending a message to the doctor that you need medical advice, right? Pay attention to that, right? The third part of it is, as you get diagnostic studies, laboratory studies, radiology studies, you have all that information in the past was buried in your chart and you never saw it. We don't have to do that. So get used to using the patient portal for whatever system you're getting care, because all that information is at the tip of your hand now because it's available to you, right? So one, if I sum it up, right, be the steward of your own care. 2, know about the conditions and the diagnostics and so on. You don't have to be a medical expert, but you got to at least understand them, right? And then 3rd, now there's all kinds of ways where the portals and the systems are explaining to you in a way you understand, so you don't have to understand the medical jargon, right? So be steward of that. And I think if everybody did that, I think we would have a better overall healthcare ecosystem.
That's true. I actually went in for a procedure recently, for a surgical procedure, and I was looking over my posted Kaiser notes. Very cryptic. I'm sure it would have meant a lot to you, or a lot to you, maybe not so much to me. So I took a snippet of it, dumped it into ChatGPT, and I literally opened with the terms of, in layman terms, explain to me what it means that it found the following, et cetera, and it did, right? So we have the tools now that you can dump it in. Here's your diagnoses, and this very short formatted post-visit notes, and it gave me a series of outcomes as far as post-surgery. These are the things that they found, and this looks normal, And then you go the one step further, which is a little bit about the asking questions of, should I have dietary concerns or other things, right? How do I recover post-surgery? And now the interesting part of the dialogue that I'm finding is there's this, won't quite call it hallucination, but a little bit of what the chat GPTs of the world, so to speak, may provide you from what some of your post-op care might be, as opposed to what a physician may suggest to me, hey, this is some of your care notes. But to your point, I do think it's at least opening up some of the knowledge or some of the access for folks to get some of that information for them. But what do you guys think about that? Both a mix of, right, the real time, kind of the real time engagement, getting some of that feedback.
Yeah, I love it. So I am the son of aging parents now, right? So my father's 76, my mother just turned 71, and I have 2 major challenges with them as they age. One, as parents, they don't want to burden me with their health issues, right? So they're hesitant to even share information, but they're not able to independently do it, because when they do have their appointments, they have a hard time capturing everything the physician's telling them, really understanding what the takeaway was to these points, right? Be your advocate. How do I interpret what this very scientific write-up of my condition is? So these technologies that can consume that information, put it in layperson's terms, and also help to make it readily available to your network of care. And I say that your network of care, the people that are tasked with your care too, like your caretakers, is a huge difference. So I just think about that from a consumer level, from a family perspective. And I think that has broad appeal in society as a whole, because we all feel tasked to care for those that are under our care, but it's an extreme challenge to do it because we don't have good tools and systems for that. So that would provide me a great deal of comfort and even make it easier to be a responsible son for my aging parents.
Yeah, and if I just add to that, right? I think you mentioned, you had to go and take the snippet of information, plug it into ChatGPT-4. We want to avoid all of that. What we're doing now is that as the medical note is generated by clinician, by physician, whether that's the discharge note when you get out of the doctor's visit, or your post-surgical note and advise on what you should follow up, we're actually automatically curating that through our own AI engine, as opposed to you going and opening a public source, engine that's not curated for medical purpose. We're actually running it through the engine we've curated and embedding that advice in a human readable form already in your chart, so you have a direct access to it, right?
Yes.
So we want to take the burden of patients having to do that and make it medical grade.
I also think about it, kind of going back to the original question, through the emergency perspective. And don't assume you're never going to have an emergency. You probably will at some point. And have you talked to your friends, family about making sure that their emergency profile is filled out on their phone? Have you thought about going to smart911.com and filling out information about your household? If you have a child with a disability, making sure that that information is available when law enforcement or fire EMS are arriving, it's vital. It can transform the outcome. So there's very simple things that we can do today. And right now that information, it's breaking in and becoming part of the response, but it's only going to increasingly become part of the response. And where you can opt in and share that information, it can lead to a better outcome. So think about that. Take 5 minutes, sit with your parents, sit with your spouse, fill those things out, make sure that they're there.
Okay, let's jump into a flash round. In a sentence or two, what we're building towards in the future, if we get this right, what do you think that looks like?
Hands-free medicine powered by longitudinal data about your entire personal ecosystem, with AI processed on top of it, helping you make every decision, whether you are doing it yourself or your provider is helping you make that decision, radically changing and improving the outcome for healthcare.
911, law, fire, EMS, I think the core job stays the same. If we're doing it right, the technology allows them to focus on doing the parts that are important to be done and takes away the parts that aren't. And that leads to a better outcome for our communities.
Public safety services that are properly calibrated to what the public need actually is. So we are a public service provider, and but we're also an industry that creeps a bit. So pulling this information together, doing a better job of identifying really what is the need the public has from us, so that we can provide that service to them, which is our obligation. We're public servants, as efficiently and as effectively as possible, so there's zero waste in the system, whether that be time, finances, or outcomes.
I could agree more. I think from a perspective of being able to pull again from this full ecosystem of what care looks like, emergent care, long-term care, what does this look like? How do we know, to your point, that these outcomes that we're gunning for have actually delivered, that we actually have a set of metrics, that we actually can show gains in efficiency of effectiveness of outcomes for folks, whatever part of the ecosystem you are, whether you're someone hosting the 911 calls, how does that happen, all the way through, hey, I'm in a long-term care facility, and these are the needs that I have. Maybe you're wearing some wearables, right? To your point earlier, you've got these semblances of measured body data, health and fitness data, combining that with electronic health records. And now that I actually understand what that service looks like for this type of case and this type of space, how do we start to aggregate and build on these data sets? And then with an overlay of some of the tools and technology that are coming into development, really start to drive those better health outcomes I think we're all looking for. So with that, I want to say thank you very much. Thank you for your time. Thank you for your insights. Each of you are visionary leaders in your space. And know that I appreciate it as a consumer of those services. Being new to ESO myself, I was absolutely drawn to the mission that we have. So happy to be part of the team.
Thank you.
Thank you.
So we'll start out with, and my name is, so it's like you introduce all the names go last.
Did anyone else have an Eminem pop into their head when he said, and my name is?
What? We'll go, what?
If you could just have a soundbite.
What? Yeah.
Yeah.
What?
I'll just have that
That is great.